Good day everyone, and thanks for joining me on today's episode of Emre Talk Show. I am Dr. Joy. I have Dr. Mark here with me, and he will be talking to us about diabetes mellitus. Ladies and gentlemen, Dr. Mark.
Thanks for having me here, Dr. Joy. It's an honor.
You're welcome. So Dr. Mark, can you please tell us about diabetes mellitus?
We all eat adequate diet for normal growth and development. Adequate diet entails carbohydrate and fats, which are the energy-giving foods. Protein, a body-building food. Vitamins, minerals, and water, in the right proportion. All these food classes gets absorbed from our intestine into our bloodstream, and blood circulates them to various organs in our body, where they are needed for normal growth and functioning of the body. This is in the healthy state. In diabetes mellitus, when all this nutrients gets into the bloodstream, fat and protein freely enters into the body cells, but carbohydrate, which is absorbed as glucose, cannot get inside the body cells, because the carrier, insulin, is missing. To be more precise, carbohydrate, that is, glucose, is usually carried from the bloodstream into the body cells, by insulin. A patient with diabetes has little or no insulin at all. So for the body to keep functioning, it turns to protein and fats, which are already inside the body cells, for energy supply. This is a wise decision by the body. However, when fat is used as energy source, it comes at a cost.
Wow, that was amazing. So patients with diabetes mellitus cannot utilize glucose for energy production because they don't have enough insulin to carry their glucose from their bloodstream to their body cells, where glucose is needed for energy production. Right. So, if the glucose cannot leave their bloodstream and enter into the cells, won't it accumulate excessively inside the bloodstream?
It will accumulate excessively inside the bloodstream. And this is what we refer to as hyperglycemia.
And what would be the implication of this?
The kidney will start to get rid of the excess blood glucose through the urine. So they might start noticing ants surrounding their urine whenever they pee. Again, they will start to urinate excessively, as the glucose in their urine will pull out more water from their body. We call this polyuria. And as they continue to lose more water from their body, they get dehydrated and thirsty often. We call this polydipsia. They also get weak and tend to eat a lot more, because the foods eaten is not yielding energy due to lack of insulin. We call this polyphagia. Over time, they will start to experience numbness of their hands and feet, poor wound healing, erectile dysfunction, poor vision and weight loss.
Wow, that was explicit. So, who gets diabetes mellitus?
Both young and the old people. The young people gets type 1, while the people older than 30 years of age are more likely to have type 2.
How is insulin being produced?
The insulin is produced in our body by an organ called pancreas. And in type 1 diabetes mellitus, there is total destruction of the insulin-producing cells of the pancreas, meaning that patients with type 1 diabetes will have to be on a lifelong insulin therapy. While in type 2 diabetes mellitus, there is insulin deficiency, implying that these patients can be on medications to stimulate their pancreas to produce more insulin or to optimize body sensitivity to the insulin produced.
So what are the risk factors for diabetes mellitus?
Obesity, cigarette smoking, alcohol, sedentary lifestyle and a family history are all risk factors for type 2 diabetes. Diabetes has also been recognized during pregnancies, but resolves completely after delivery. However, about 50% of these patients goes on to develop type 2 diabetes later on in life.
So what's your final word for our viewers today?
No words. Don't ignore diabetes. And if you are experiencing any of the mentioned symptoms, please visit the hospital today for early diagnosis and treatment, and to prevent the complications of diabetes mellitus.
And so that's it on today's show. Thanks to everyone out there for watching, and special thank goes to my guest Dr. Mark, alongside me.